Hello, I am Dr. DeAndre. Today I will talk about breast cancer symptoms explained in a simple, clear, and medically accurate way so that everyone can understand and recognize early warning signs. Breast cancer is one of the most common cancers globally, affecting millions of people every year. While it is more common in women, it is important to understand that men can also develop breast cancer, although at a much lower rate. From a medical perspective, breast cancer begins when abnormal cells in the breast tissue start growing uncontrollably. These cells can form a tumor, which may remain localized or spread to nearby lymph nodes and distant organs if not detected early. The key challenge with breast cancer is that early-stage disease often produces minimal or no pain, which leads many individuals to ignore warning signs. Clinical studies show that when breast cancer is detected early, survival rates are significantly higher, often exceeding 90% over 5 years. However, when diagnosis occurs at a later stage, treatment becomes more complex and outcomes may decline. This is why awareness and early recognition of symptoms are critical. Many individuals dismiss early changes such as a small lump, mild skin changes, or nipple differences because they assume these are harmless or temporary. While many breast changes are benign, there is no reliable way to differentiate without proper medical evaluation. In this video, I will explain the most important symptoms of breast cancer, the biological reasons behind them, and when you should seek medical attention. The goal is to provide clear, evidence-based knowledge that empowers you to take action early and protect your health. One of the most recognized and important symptoms of breast cancer is the presence of a lump or thickening in the breast tissue. This lump may feel different from the surrounding tissue and is often described as firm, irregular in shape, and usually painless in the early stages. However, it is important to understand that not all cancerous lumps follow the same pattern, and some may feel softer or even tender. From a biological standpoint, this lump forms due to the uncontrolled division of abnormal cells within the breast. As these cells multiply, they create a mass that disrupts the normal structure of breast tissue. Over time, this mass may grow and become more noticeable. In addition to the breast itself, lumps may also appear in the underarm area, where lymph nodes are located. This can occur if cancer cells begin to spread through the lymphatic system. It is essential to note that not all lumps are cancerous. Many are benign conditions such as cysts or fibroadenomas. However, the key concern is any new lump that persists or changes over time. Regular self-examination helps individuals become familiar with their normal breast texture, making it easier to detect abnormalities. If a lump is detected, medical evaluation should not be delayed. Diagnostic tools such as mammography, ultrasound, or biopsy are used to determine the nature of the lump. Early detection at this stage can lead to more effective treatment and significantly better outcomes. Changes in the size, shape, or overall appearance of the breast can be an early sign of breast cancer. These changes may be subtle and develop gradually, making them easy to overlook. However, any noticeable difference that cannot be explained by normal factors should be evaluated. From a physiological perspective, tumors can alter the internal structure of the breast. As a mass grows, it can distort surrounding tissue, leading to visible changes in contour. This may result in one breast appearing larger, smaller, or differently shaped compared to the other. In some cases, swelling may occur in part or all of the breast, even without a clearly defined lump. This can be due to inflammation or blockage of lymphatic drainage caused by cancer cells. It is important to differentiate between natural variations and abnormal changes. Hormonal fluctuations during menstrual cycles, pregnancy, or aging can affect breast size and shape. However, changes that are sudden, persistent, or progressive should not be ignored. Medical evaluation typically involves imaging studies to assess internal structures. Early identification of structural changes can lead to timely diagnosis and improved treatment outcomes. Skin changes are an important but often overlooked symptom of breast cancer. These changes can include redness, dimpling, thickening, or a texture that resembles the surface of an orange peel, medically known as potty orange. These symptoms occur when cancer affects the lymphatic vessels within the breast. The lymphatic system is responsible for draining fluid from tissues. When these vessels become blocked by cancer cells, fluid accumulates, leading to swelling and changes in skin texture. Dimpling occurs when underlying tissues are pulled inward by the tumor, creating a puckered appearance. The skin may also appear inflamed or develop unusual discoloration. In some cases, there may be persistent itching or irritation that does not resolve. These symptoms can sometimes be mistaken for infections or allergic reactions. However, if they persist despite treatment, further evaluation is necessary. Healthcare providers may use physical examination, imaging, and biopsy to determine the cause. Recognizing these skin changes early is critical, as they can indicate more advanced involvement of breast tissue. Changes involving the nipple are another important sign that should not be ignored. One of the most concerning changes is nipple inversion, where the nipple turns inward instead of pointing outward. This may occur suddenly and persist over time. From a medical perspective, this happens when a tumor located behind the nipple pulls on surrounding tissue, altering its position. Nipple discharge is another symptom that requires attention. Discharge that is bloody, clear, or occurs without squeezing is particularly concerning. This may indicate involvement of the milk ducts by abnormal cells. While nipple discharge can also be caused by benign conditions such as hormonal imbalances or infections, certain characteristics increase suspicion. These include discharge from only one breast, persistent occurrence, and association with other symptoms. Medical evaluation may include imaging studies and laboratory analysis of the discharge. Early detection of abnormalities in this area can significantly improve treatment success. Although breast cancer is often painless in its early stages, some individuals may experience discomfort or pain. This pain may be localized or diffuse and may not follow the pattern of normal hormonal changes. Pain can occur if the tumor affects surrounding tissues or nerves. In some cases, inflammation associated with cancer can also contribute to discomfort. Other symptoms may include swelling, warmth, or changes in skin sensitivity. In advanced stages, there may be visible ulceration or discharge from the breast. It is important to understand that breast pain alone is not a strong indicator of cancer and is often caused by benign conditions. However, persistent pain combined with other symptoms should be evaluated. Medical consultation ensures that the underlying cause is identified and managed appropriately. In summary, breast cancer symptoms can include a lump or thickening, changes in size or shape, skin abnormalities, nipple changes, and sometimes pain. These symptoms may appear mild initially but can indicate serious underlying conditions. Early detection remains one of the most effective ways to improve survival rates. Regular self-examinations, routine screenings such as mammograms, and awareness of symptoms are essential components of prevention and early diagnosis. Healthcare guidelines recommend regular screening, especially for individuals over the age of 40 or those with risk factors such as family history. If you notice any unusual changes, do not delay seeking medical advice. Early action can significantly improve outcomes and may even save your life. If you found this video helpful, consider sharing it to spread awareness. Your awareness can save lives.